what did you learn last week? Well, I learned that becoming a health worker and putting your life on hold and on risk to save the lives of other people is not enough to keep you safe and to earn you the respect you deserve. And when I say this, I don't just mean the safety and the lives of doctors or female doctors. I'm also seeking to include all types of health workers, including A&Ms, clinical nurses, ASHA workers, and male doctors who might not be facing possibly violence of a sexual nature, but they are at threat from violence. I've come across so many stories of nurses talking about the threats they've received, of young male doctors sharing about how very often they are threatened if they can't save the patient, or their families are threatened. A few of them even talking about physical violence that they've been on the receiving end of. And what's happened today and what we're talking about in Kolkata shouldn't just be another thing to look across the Rakhi lunch table and go, oh God, that was so bad. That is such a sad thing to happen. It needs to go into something more impactful and bigger than that. Because it would be a very, very sad day if one day a father looked at his son or daughter and said, Beta, don't enter the medical profession, it's not safe. So we do need to do something. I also learned that since I have been vaccinated from smallpox, I'm not at risk from getting a very severe infection from monkeypox. And that apparently on the internet, there are some people who believe that if you kill monkeys, you'll eradicate the virus, which with the very, very limited medical knowledge I have, I can, however, say with full certainty is not the case. It's gone from monkeys and it's entered human beings, and it's humans who are giving it to one another. That said, do not kill one another either. Practice safe sex and hygiene, and tune in to our episode on monkeypox, which is to air 2 weeks down the line. The last major learning I had last week was that there are 36 cancer awareness days marked in a calendar year, including an esophageal cancer awareness month, a sun awareness week, and a less survivable cancer awareness day. But do all these days really help? I mean, aside from being excellent fodder for marketing pitches, and I should know because I reply at least twice daily saying that I'm very sorry, but hand washing day is not a news peg, but thank you for reaching out. So beyond that, do these days actually have an effect, and do they lead to more screening and prevention of a disease that's claimed nearly 1 million Indian lives in 2022, which is according to the World Health Organization estimates, which was released in their Global Disease Burden Survey. And most importantly, do all these days lessen the number of alarm bells that start ringing and that little voice in your head that goes, I am so screwed, when you look at your prescription and it says the words chemotherapy? This is Sonali Acharji, and you are listening to Health Wealth, a podcast that believes in simple scientific information. So you will never hear the words holistic, integrative health on the show. And if you do, I promise we will also tell you what the holism comprises of. Because jargon and big terms by themselves, they really serve no purpose for a person who wants to look after themselves. There is another word which I believe is heavily overused today, and that is experts. Experts say, experts recommend, experts claim, experts note, experts caution. Who are these experts? And as a consumer of news, because I'm not just a chronicler of it, I read it as well. So often I go through these articles or listicles, and in the end I'm like, I've wasted my time because this person doesn't have expertise in the domain that I'm reading about. Whatever profession you are in, look back to the number of hours you spend studying it and the number of days you spend developing practical knowledge of it. And then ask yourself that, Could someone in a week or two read an online manual and reach the level of proficiency that you have? So when I bring in experts for this podcast, I invest a lot of time in making sure that they have the theoretical and practical expertise on the subject we are discussing. Today, as the title says, we would be talking about chemotherapy. It's a treatment for cancer that has historically received so much of bad press, and there's always a lot of fears and doubts accompanying it. I know that oncologists, who are the doctors who treat cancer, even today very often have to fight with patients to convince them to go for that chemotherapy, and they still receive a lot of resistance. So if this episode is to guide you or someone you know through a chemotherapy session, I couldn't bring in someone who has just read an entry on chemotherapy on Wikipedia. It matters deeply to me that something as crucial as your health, when it's something so crucial at stake like your health, that you are guided by the best minds in the medical profession. One mistake, one wrong advice, one misassumption could cost you either the quality of your life or worse, your life itself. Sometimes I really don't know which is worse. So we have with us today Dr. Ankit Jain, who has worked as an oncologist for over 2 decades. He is currently a senior medical oncologist at the Apollo Cancer Center in Delhi. And he studied oncology from the University of Birmingham and not ChatGPT. Hello, sir. Thank you for coming in.
Thank you, Sonali.
I did want to ask right out, that there's still so much of confusion over internet information and medical education. And because of, corporatization of hospitals and the parking queues and the tiny fonts on the appointment booking app, it getting to a hospital often seems too much. So even though we know self-medication is bad, we still want to do it because it's just the easier option. So if I had to hypothetically ask you that, God forbid, tomorrow you lose your 9 to 10 years of medical education and your over 20 years of practical knowledge that you've gained as an oncologist, could you regain all that expertise and knowledge just by using the internet?
So what I would say, Sonali, is that once you browse through the internet, you do get some information which might be used in a positive way. The most important thing I would suggest is that it is very important to use it wisely. I would not just negatify whatever information is present on internet, because sometimes it does help, but you have to be wise enough to understand that which are the points that you have to extract out of that, and then how you make what we say is an informed decision. Because some of the information can be used to get a bit of idea on how things are, what your diagnosis could be, or how your treatment pathway is going to span out. But it will be much more wiser if it is used further on in the realms of some advice from experts. Mm-hmm. And then discussions with the family and friends before you make a final decision on what is in your best interest.
Yeah. And so we're going to talk about chemotherapy, and I just tried to do an internet search on it, and there's I don't know how many bits of information on it. As an oncologist, how would you define this procedure?
So just to get the simple facts right, first of all, chemotherapy, you don't have to be genius enough to realize that it's made up of 2 words, chemo and therapy. Chemo means chemicals and therapy means treatment. So chemotherapy is a drug treatment which uses strong chemicals to kill the strongly dividing, fastly dividing cancer cells. And it could be used in various forms. It could be used in the form of intravenous drip or sometimes the tablets. But either in the tablet form or intravenous form is as effective as the other one. And similarly, when it is acting on the cancer cells which are fastly dividing, it also acts on your normal cells which are fastly dividing, and there comes the side effects. So it's very important to understand, weigh and balance the risk and benefit of chemotherapy as you possibly would do with any treatment.
Yeah. And you mentioned, how efficient chemotherapy can be. What are the main factors that determine whether it's the right procedure for a particular kind of cancer?
So a lot of these treatments, as you possibly know, are all evidence-based, which have been tested widely internationally in various clinical trials, in which it has been shown that this particular form of treatment, whether it is chemotherapy or a combination of chemo with some targeted therapy or surgery, improves not only the quality but also the quantity of life of a patient. So all these evidences really justify the role of chemotherapy. And what I would normally say is that various cancers have various type of histotypes or subtypes, and depending upon their subtypes, you have different roles of different chemotherapies. And one thing which I normally tell all of my patients is not all chemotherapies, just like not all cancers, are same. So I know that there is a lot of negativity sometimes attached or myths attached to how good or bad a chemotherapy is. But what a patient should know, first of all, is what type of cancer they have and what kind of chemotherapy are they being given. And if they are being given chemotherapy, whether it's a single agent or combination of 2 or 3 drugs, because combination usually gives you better survival, better responses, but similarly, sometimes combinations might have a different kind of combination side effects. So it's very important to know for the patients to really understand their cancer first and the type of chemotherapy which they're being offered.
Yeah. So, in India, we have 3 cancers which are quite leading. I mean, they're the top ones: lung, breast, and oral. So if you focus on these 3, how effective is chemotherapy today for treating these 3 cancers?
So one of the good evidence which is now emerging about any form of treatment in cancer world is that whereas previously we were doing much better in terms of stage 4 cancers, where the role of any treatment was mostly in terms of not trying to find the cure, but to try and shrink the cancer, improve the symptoms and possible extension of life. Now, a lot of these drugs have moved a bit more in early stages, where we're trying to achieve cure by giving the treatments upfront. Now, when you say that these 3 common cancers in India, a lot of these cancers usually now have evidence of using chemotherapy or a combination with other treatments to try and improve the role of surgery, because they downstage the cancer so that the surgeons can go and effectively remove the cancer completely. And then sometimes the chemotherapy is also used post-surgery to reduce, or what I normally tell my patients, to mop up any cells which might be hiding and waiting to come back in the future and bring the risk of cancer back. So that way, early stages, there is much more effective treatments available now.
Yeah. I'm going to play a patient's advocate and say that one of the most distressing thing that patients go through is that you're given chemotherapy by, say, one oncologist, and you have to get a second opinion. I mean, how can you not?
Yes.
And then a third is also good. So all 3 give you different treatments. Why is that? I mean, why does that happen?
What I would say is that a bit of doctor shopping, especially like coming from abroad after 20 years, and in last 4 months of my practice here in India, I've realized there's more doctor shopping in India as compared to other Western countries.
So people must be flocking to you if it's as you've come back from the UK.
It does happen. It does happen.
Yes.
And I try and find my best expertise or best time to kind of give them a proper answer. But sometimes patients should realize that we don't have the right answer, because there is actually no right answer. What I normally say is a decision is the right decision when it is made. So whichever decision has been made is the right decision.
Yeah.
What we need to find out, first of all, is that sometimes 2 doctors give various opinions or different opinions or contradicting opinions, mainly because there isn't one particular opinion. With evidence, there might not be a very strong evidence for that particular treatment. There might be reasons that one doctor thinks that the risk-benefit ratio might not be in the interest of the patient to get that treatment, at least for now. They might possibly prepare the patients by sometimes we give them steroids to make the performance status or fitness better, and then possibly try and give the treatment like chemotherapy in the future if we think that now the risk-benefit ratio justifies introducing chemotherapy. Or there could be some very low benefit evidence, in which case, depending upon the performance status or fitness level of the patient, or their comorbid conditions, or how they are in terms of family support, we think that giving chemo for a minimal benefit might not be justified. So if there are two doctors giving contradicting opinions, the first thing you should do is ask your doctors, is there a rationale why one person is offering the treatment, the other one is not? And you might be surprised that normally people actually take it positively. Like if somebody comes to me saying that I've taken a second opinion, and this is the reason, we actually want patients to be more intelligent, challenging us, because that helps in us to grow as well. Because we sometimes, it happens that we might have made possibly not the right decision. And when the patients come back with some kind of opinion from somewhere else, we feel that possibly, yes, that might be right. And there is no harm in accepting that this is the case. The other thing patients can do is ask about whether this case has been discussed in a tumor board meeting. Now, this is a meeting which is carried out in most of the advanced hospitals at the moment, where the set of experts sit together and then they decide whether this particular treatment is in the best interest of the patient. And sometimes if a patient is being seen by comparatively a junior consultant, he might seek an opinion from a senior consultant so that a holistic and a team decision is made in the best interest of the patient. So I think that is the way possibly it could be arranged. One more thing, maybe you should know your doctors or know your hospitals well. Something like KYC, I'd say KYD, know your doctor. And then you will know that whether they have the right reputation to treat you.
Yeah. Sometimes even reaching out over the email is a very good option. I've tried it many times and I've received a lot of help from doctors. But I think sometimes we also expect our doctors to be beyond human beings. And because it's health, it's such a deeply personal, close thing to you. I mean, it's everything, right? So when that goes for a toss, you want an answer and you want the best. And we forget that with anything, if there's a certain amount of uncertainty involved, you can't always guarantee the outcome or the path for that outcome. So, I mean, I often say this with cooking. Like if people in my family come and they say, 4 doctors have given 4 different things. I said, well, I make these cookies at home and 4 different chefs have 4 different ways of doing it. Yeah. And they all turn out okay. But when I'm following the method, at that point, I really don't know what is going to turn out to be. So why do you expect so much from a doctor?
Yeah, precisely. And that is what happens when we are making a decision. Suppose I make a decision about my patient. I always have a particular forward plan that if I do this first, I will possibly achieve this outcome from this treatment. Then this will be extended with another treatment. Now that mind frame will not be known to another doctor who might be making a different kind of a plan in his mind. Now, we normally practice all evidence-based medicine. So I would not say that sometimes if some other doctor has given you some second opinion which is completely contradictory, might always be wrong. So what you need to do is just find out the rationale for the treatment.
Yeah. So I'm not going to sugarcoat this. Cancer is spreading. There's a very high likelihood that someone listening to this might be under cancer treatment already or preparing for cancer treatment. We had done an episode a while ago on carcinogens and how to prevent cancer. But in the event that somebody is now preparing for their first chemotherapy session, what should they be thinking of before they go for that first treatment?
So I think the most important thing is to know or get a leaflet on the side effects of that particular chemotherapy. Because most of the times you get the problems with the side effects because of lack of knowledge about them and not knowing that when and how to report those side effects and whom to report those side effects. One of the most important side effects of chemotherapy, as possibly you might know, is that it reduces your immune system, especially in the second week of a 3-weekly cycle of chemotherapy. And that is when you become prone to infection. Now, those infections are usually viral infections, and they get better, like they get improved very quickly. But if your immune system keeps on going down, then the simple infection could become sepsis. And sepsis is what could take lives
If you
of a
could just
chemotherapy patient.
quickly explain what is sepsis.
So sepsis means basically the bacterias going into the blood and then spreading all around. So as long as there is an infection which is confined, it is easy to treat. But when it goes into the bloodstream, then it really affects the patients in terms of dropping their blood pressure, making their heart rate go up. And if it is not treated effectively at the right time, then the patients can die of sepsis. And with various researchers, it's been shown that if the antibiotics are given through the drip within 1 hour of this presentation, it saves lives. And it's something very easily treated. Problems comes when it is gone unnoticed and it goes to sepsis stage. So this is something to keep an eye on. So whenever you are on chemotherapy, measure your measure your temperature twice a day by default at least, and more often if you feel unwell, and report to the emergency services or your doctor team if your temperature goes up, because that justifies bringing in to the hospital, checking your blood counts, make sure your immune system is fine, and whether you need a course of antibiotics.
Yeah. If you could be a bit detailed right now about what happens during the session of chemotherapy. So supposing I'm a patient, I walked in, how long is the session and what happens to me during that session?
So that can vary upon what kind of chemotherapy and how many chemotherapies you're being given. Now, chemotherapy is given in form of what we say cycles. Now, those cycles could be every week. Some of them are every 2 weeks, 3 weeks, or 4 weeks. Now, when somebody comes to the chemotherapy unit, usually it is a daycare treatment, and you usually do not need to be admitted overnight unless it's a long treatment, or if the patient lives far off, or if there's a personal choice of getting admitted. So usually it's given in a daycare unit, as I said, on a reclining chair. And it's much more calm atmosphere where chemotherapy is given. Chemotherapy itself directly is not painful, but it can cause some inflammation in the veins sometimes, and that can cause temporary pain. Or if as a side effect, some of the chemotherapies can cause muscle pain, joint pains. But the good thing is that all of these are reversible. They can be supported by giving painkillers, and they do respond.
Yeah. Once a session is done, in, say, the couple of days afterwards, in fact, let's start with the hours. Should a patient have someone to drop them back home? And when they go home, what are the sort of safety precautions they can take?
It's always preferable that a patient should not drive on the day of chemotherapy, and somebody should take them home. The reason for that is very simple. Like as any other drug, especially if they're getting chemotherapy, there are chances that they might feel a bit dizzy and might cause problems, if you're driving or you're going on your own. So better to take someone with you when you're driving back home. And what was the second question? Sorry, is it about...
Once you go back home, are there some safety precautions you can take in the days immediately after?
Yeah. So safety precautions are basically you just need to be sensible. As we all were sensible during COVID times, a patient should know that their immune system will possibly go down. So you just need to be sensible enough, to mask yourself if you're going out in crowded places. What I also say is if you have young children, they normally carry a lot of viral infections, especially if they go to schools and nurseries. So you can still cuddle them, you can mix with them, but if they're looking actively infectious, just try and maintain a bit of distance. Use proper hygiene methods like washing your hands. If you go out, and make sure it's not very crowded, and if it is, then just mask up.
Yeah. And this is something which is quite personal to me to ask also, because I think it's very often overlooked. We talk a lot about nutrition when it comes to immunity and chemotherapy recovering. I don't want to get into nutrition because it's all over the place now, but we don't talk enough about sleep and resting. Can you tell me the importance of rest and good sleep, good regular sleep in recovering from cancer and chemotherapy?
I think that's a very important point that you've raised, and thanks for that. A good sleep is very important for cancer patients, especially when they're going through the procedure of any treatment, not only chemo, but even surgery or radiotherapy. A lot of this because the good sleep releases good hormones or endorphins in the body, which helps in better recovery. It improves your heart health. It helps in improving your immunity and gives you more ability to fight any stress. It's a stress buster. So good sleep definitely on, at least for 7 to 8 hours.
Aren't you glad I didn't ask you 5 foods that will build your immunity post-chemo? One of the reasons where, I can speak for myself and for the people I know, but the biggest panic about chemotherapy is, of course, the side effects. We've seen so much of media material on, people who have lost their hair, their bones have become brittle. They paint such an unhappy, depressing picture, and you just keep thinking, that's going to be me now. How have side effects evolved with chemotherapy? And these drugs are much more targeted now, but when you say that, how targeted are they?
So one thing which I tell to all of my patients is that you fear the side effects. Mm-hmm. Yes, but then people come to you with the side effect stories only when they have actually gone through the worst. Never ever will a patient come to you and tell you that I've had no side effects and I'm completely hunky-dory with no problems. So just don't accept that if somebody is telling you the side effects, this is how your life is going to be when you will be on chemotherapy. And the most positive point is that we are now well versed with how to manage these side effects. There are much more better effective medications which are available, especially in terms of vomiting drugs. Like if you see the old movies, then you can see a bucket of, just around the bed, which is collecting all the vomiting. But this doesn't happen that much now. There are very good effective drugs available in terms of controlling vomiting, in controlling the diarrhea, and things like hand and foot dryness and mouth ulcers. So all of these medications can support all the side effects. But the main thing is they should be reported at the right time.
Yeah. Can you tell me, given modern chemotherapy drugs, if these statements are true any longer?
Sure.
The chemotherapy makes you very, very cranky.
It can, but then again, it will be temporary. A lot of this could be just not the chemo itself, but some of the side effects. Or maybe sometimes we give steroids after chemotherapy for 2 or 3 days to control other side effects. And some people don't react very well to the steroids, and that can make you a bit irritable. But some of the treatments can cause you constipation, and that can again be a reason. But they can be again reversibly treated with some supportive medications.
Does chemotherapy cause cognitive issues?
Yes, that's something which is known. A terminology which we say chemo brain. So patients get cognitive impairment if they have multiple lines of treatment, but there are ways to kind of rectify or minimal kind of side effects can happen on that front in terms of maybe speaking to the patients a bit more. Don't let them just stay, on their own in their rooms. So they should talk to people. There should be some clock or calendar in the room where they are so that they are aware of the time and date. And I think that would possibly help.
And does chemotherapy make men infertile forever?
Not only men, but also females. So basically, as I said, that the chemotherapy acts on the rapidly dividing cells. So all the rapidly dividing cells which are related to the reproductive systems could be affected as well. Now, whether it is temporary or permanent could vary from one person to the other. But if somebody going through chemotherapy is of young age and haven't completed their family, then their doctors should be discussing this before starting chemotherapy in terms of whether they want to go for procedure to preserve their sperms or their eggs.
Yeah, and this one I'd be very, very amused if it turns out to be true. But does chemotherapy give you the urge to become a vegan?
Oh, I've never been asked that. It could possibly...
There was a blog post on this by a cancer patient who said that after chemotherapy, she couldn't eat dairy or meat anymore. and she's a vegan now.
That might be because chemotherapy causes taste changes. So it does.
Now I'm terrified.
So what happens is like
no more bacon for me.
So what normally happens there is like if some people like one particular food before chemo, they start hating that one later on, and vice versa. And so normally what we say is that use regular medicated mouthwashes, which are normally prescribed, and try and drink as much water as possible. Keep your mouth moisturized and not moisturized, but hydrated. And see what likes, because sometimes you might get your taste back once the chemotherapy is done and dusted.
Yeah. So I'm going to ask you, it's a slightly difficult, sensitive question, but we're talking about risk-benefit ratio, and chemotherapy is a difficult procedure, no doubt. So is cancer. Supposing I don't treat my cancer, what happens to my body? And you as an oncologist must have seen people in the final stages of cancer. What is that? Like, what happens? Like, how does death come from cancer finally?
So cancer is one of the diseases which is basically leading your body into some negative metabolism, so that patients who are not having chemotherapy or any form of treatment for cancer, they go through the process of most of the time slow and steady decline, when their fitness levels, their cognition, their ability to do anything would slowly deteriorate, and they'll be less responsive. That is one of what I say is a comfortable way of dying with cancer. But that needs a very good team to take care of most of the symptoms with supportive medication, something called palliative care. Now, palliative care is not very advanced in India at the moment, but I was pleasantly surprised to know that it is actually much better than what I thought would be happening.
It is there.
Yeah, so that is good. And a lot of this is also involving some other alternative therapies like meditation, yoga if possible, or even just some family support. And I think that is very, very prudent in Indian society, that we have effective family support. A lot of patients, sometimes what I used to see abroad, were that they were very lonely during that part of their lives. So that is important. Sometimes it could be an acute event, like cancer makes your blood system go through what we say atherogenic stage, in which you might throw a clot somewhere, which can quickly go into your lungs or your heart and lead to a sudden death. So that could be one of the things as well. And then depending upon the cancer, of course, like if it is in gastric system or lung system, if it is continuing to multiply, then the symptoms will be related to that particular organ and might again lead to the death of the patient.
Yeah, and if it's an oral cancer, you can see the tumor.
You can from outside, and sometimes it grows on the outer part of the body as well. So
painful.
that could be very disfiguring and could hamper not only the quality to eat and drink, but could also cause problems with the breathing. And that is where, even if the chemo or radiotherapy role is not there, there is a definite role of drugs to control the pain and make patient as comfortable as possible.
Yeah. But thankfully, if we do screening on time, we can opt for chemo and get rid of the cancer cells. Apart from chemo, there's so much happening on cancer treatment. And we have done an episode on CAR-T therapy, which is part of immunotherapy. But as an oncologist, are there some treatments that you're particularly excited about and happy that they're there?
So immunotherapy has actually been changing a lot of ways we are treating cancers now. A lot of the evidence for immunotherapy was in the stage 4 cancer, but is now coming in early phases in either combination with chemotherapy or immunotherapy on its own. So what immunotherapy normally does is it makes your immune system go smart, because then it is able to identify the cancer cells, and then what happens is all these immune cells get supercharged. And when they get supercharged, it's like a tsunami of response on the cancer. But similarly, there can be some effect on the normal cells as well, because those hypercharged immune cells then start identifying your normal cells as foreign cells. And that is where they cause the side effects. But these side effects can be controlled effectively by giving medications. Now what is happening is with immunotherapy, we are now doing more trials in finding how we can make immunotherapy more effective by combining them with something called immunomodulators. And these are the new drugs which are being tested either in combination with immunotherapy only or again with immunotherapy and chemotherapy. So I think that is where this precision medicine is going much more advanced in the future.
Yeah, so we can look forward to not turning vegan if we go through chemotherapy.
Exactly, yes.
When you're going through any medical treatment, you have your physical strength, your physical abilities, but so much of that is also dictated by your mental abilities and what you're feeling. Sometimes you get tired in between chemotherapy sessions. It is a lot. Supposing somebody is listening right now and they know someone or they are someone who is struggling to return to chemo, wants to stop it. Is there something you can give for motivation right now?
So one thing is, it's very normal that there'll be times, there'll be good and bad days. And when there are bad days, you are allowed to take good amount of rest or maybe say no to chemotherapy for that time. But those might be turned into good days when possibly that chemotherapy could start again. So first of all, I would say give yourself enough time. Don't get disheartened. Have a good mental health. Like some people try meditation or go for prayers, and all of them do work. Talk to people, have people around you, a good support from the family and friends, because that helps. And stay positive. Believe in the drugs, believe in the doctors. Having that confidence usually work. Now, when I was working in the UK, I found some of the patients who were so happy with what is happening and just not looking at the negative side, and that helps. And those patients I knew right from the beginning would possibly do much better than if you start thinking just negatively and become super anxious about because whatever is going to go wrong is not in your hands. So what is in your hand is that think positive and hope everything goes on well.
Yeah. And if I could ask you right now to not be Dr. Ankit Jain and just be Ankit Jain, can I ask you, how do you handle the emotional burden of being an oncologist? Because cancer isn't just physically distressing, it's financially crippling. It's emotionally distressing. It can tear families apart. How do you deal with so much of that?
So Nali, that is very difficult. And we all oncologists or any doctors, we go through that process. I think the key thing is that there should be a time to switch off. So once you are working, you're working to your best abilities, trying to provide whatever you can to your patients and their families. But once you are back in your car, you need to listen to music, go home, relax, and just don't think about work. Meditate, eat healthy, use your holidays, use your Sundays to get your energy levels back, and stay positive.
Yeah. I recently discovered that there are some doctors who listen to this podcast, and assuming that there's someone who's starting out in oncology gets to hear this, what advice would you give about patient and doctor relationships? How do you build them, but also how do you maintain that distance? How much is too much and how much is too little?
The main doctor-patient relationship comes in the first meeting. So you need to give adequate time to your patients when you meet them first. Try and get to understand them. It's not only about their cancer, but try and find out details about their past medical conditions, a detailed history of their drugs which they are taking, what are their psychological levels, what kind of support they have, and then offer them advice. Be a good listener, because that is important. A lot of times you see the cancer patients are actually very scared. All they want is somebody who can listen to them. And if you just listen to them, give them appropriate advice, they will be fine. A lot of times they are just scared to ask questions because they think you ask three or four questions, the doctor is going to be getting angry. But just give them time and they'll be fine. But when you practice oncology, one thing I would say to all the junior colleagues is it will make you a better person. It will tell you that even a single second in life is important, because that is the time now when you are well. So don't worry about the future. Be happy with what you've got now.
I personally love talking to doctors because with every interview I do, I feel so positive at the end of it. And it's so unusual, sir, but you are correct. We fear asking doctors questions because we think, oh, they're so smart, or oh, they don't have the time, or oh, I'll have to pay more. You don't charge per question. And so thank you for sharing everything you have. I think it makes people feel very positive to know that chemo is not as bad as we think.
Thanks a lot, Sonali. I must say, all the listeners, if anybody has cancers, I can assure you that we as doctors and nurses are there for you. We are there to take care of you, listen to you, and hope that you can fight the cancer, because we know that you are strong.
And you will answer all questions.
Exactly. Thank you.
There is no magic pill or absolute guarantee for your health. If there's anything I've learned over my years of health reporting, it's that there are some things that do increase your probability of enjoying relatively good health as you age. There are some things that will ensure you won't have a stent in your heart or titanium in your knee by the time you're 90. But what I've learned is don't kill yourself doing that either. Find that balance between enjoying your life and looking after yourself. So yes, do the healthy stuff, eat your oatmeal, go for the walk, and stop being friends with your phone and social media, but also enjoy your life. Take some time to marvel about how you've pushed yourself through those challenges. Catch up with that friend who's been missing you so much, and enjoy the marvelous wonder that is a pistachio raspberry croffle. Have you ever gone through chemotherapy? And what was your experience like? Did this episode help you in any way in preparing for chemotherapy or understanding a bit more about cancer treatment? I'd really like to hear about your thoughts and your health experiences. You can write to us at pods@indiatoday.com, or you can message us on 8588 966 996. We are also available on social media channels, so regardless of what you prefer, we're there on Facebook, Instagram, WhatsApp channels, and X.